Now, the Ritshidze community-led healthcare monitoring project report on Limpopo's public health system has found that patients lack a critical treatment as a result of understaffing, long waiting periods and not enough medication. The report found that the province had failed to meet the United Nations HIV Sustainable Development Goals and that the lack of medication, privacy and understaffing were major problems. To tell us more about this, we're joined by the National Chairperson of Treatment Action Campaign, Sibongile Tshabalala. Sibongile, very good morning. Thank you for speaking to us. Now, what are some of the things that pop out from this report that you carried out?
Thank you for having me. What has popped out from this report is that we in Limpopo only 73% people who are in treatment instead of having at least 95%, and too many people never start ARVs, or they start ARVs when now they are in bad conditions. Also, it has come out from this report that people have to wait for 6 hours in the clinic to get services, and only 94% of the facility managers that were interviewed reported that most of the time they don't have enough staff in facilities, which it makes it difficult for them to do their work, and only 38% of patients left without without their medication in facilities. So that shows that the Limpopo province is the worst performing province when it comes also to HIV refill, ARV refill length, with only 46%, 46.4% of people only receive 1 month or less of ARVs, while the secular and the department policy says at least people who are stable on treatment, they need to access at least 3 to 6 months medication. So those are the challenges that are coming out from this report to say Limpopo is not doing well when it comes to issues of health.
Sibongile, you've labelled them the worst. Have you carried out similar exercises in other provinces across the country, and how do those figures stand?
Yes, we are carrying it out. If you might remember, last month we were doing the report on Northwest, which also it doesn't do well. Actually, based on the reports that we are getting and the surveys that we are doing, the country is not doing very well in terms of services on the ground, especially the HIV services. And for us to reach the 95 targets, we are still far with all these challenges that we are facing as a country. Next month we will be issuing a report, and Free State Limpopo health report, and the other month on October will be issuing Eastern Cape report. So we continue to issue these reports monthly based on the province, but all in all, the overall state of the country, it's not in good condition, and we are no longer in crisis, we are collapsing.
Only recently Limpopo has been praised as being a model province for their vaccination drive. Do you get the sense that there is a clash in priorities here?
Yes, there is a clash in priorities. Actually, ever since we have been affected by COVID, it seems like all government officials, all departments, and especially Department of Health, the only focus now is COVID, which is it's not wrong. It's okay. We want everybody to be vaccinated, but we shouldn't forget the challenges that we've been having. We shouldn't forget the illnesses that we've been having all along, because by the time we reach our targets on COVID-19, but we'll have a huge gap that will be opened in terms of our ARV program and other chronic illnesses that we are facing on the country. Remember, we still have women who are affected by cancer. We still have people living with HIV. We still have all these other chronic diseases that we've been having challenges with, and we were not doing well unto it. So if we neglect all the programs, all the progress that we have made already, then it means by the time we vaccinated everybody in the country, but people will be dying of other chronic diseases. So we are saying that as much as we need to focus on COVID, but we shouldn't put the 100% of the focus in COVID, but they also need to continue to acknowledge that there are gaps in other chronic illnesses or other plans, and we need to close all the gaps concurrently.
Well, two things I'd like to ask. First is, take us through the numbers of individuals, particularly Limpopo, that are affected, those on HIV and other chronic medications? And secondly, what was your recommendation on how to mitigate this challenge? What is the advice that you would give on how we can move forward, or how Limpopo and other provinces can move forward and not derail the progress that has been made in other areas?
One of the recommendations that we issued out, or we recommended to the Department of Health, is that they need to fill the gaps of staff. So we know that during the COVID we've lost staff, of which before even COVID we had challenges on the issues of staff. So the staffing is very problematic, and until we fix that, we hire more nurses, more doctors who are supposed to be there, and also non-clinical staff that also needs to support the department. We cannot be able to close all these gaps. But also the attitude of nurses, because that also drives away people from the facilities. The attitude of staff in the facility is very important, and it needs to be dealt with. We don't only need 57% of staff attitude, we need 100%, so that people, they might be able, they can be able to go to facilities, but also to mitigate the issues of stockout, which is also the problem. You can have a province that has 38% of patients leaving the facilities without their medication. So it's very important to close those gaps. So those are the recommendations that we said to the Department of Health in Limpopo, to say at least if they can try to close those gaps, it will make their work easier, and we feel like they will be able to reach some targets.
I'm glad you raised the issue of the attitude of the nurses, all the staff, and I think you've pegged it at 57%. Ideally, you want it to be at 100%. But one of the issues that was raised in your report was an individual who spoke about privacy and the fact that some patients will stand in a queue knowing that they're HIV positive, seeking treatment, but the nurses or the officials make that information public to everyone.
Yeah, one story that came out is the issue of confidentiality in the facility. When one woman said the nurses or the staff from the facility, they were talking about her status in the facilities. So the department needs to make sure that the confidentiality should be kept in the facility. She even said, if I'm sitting in a tavern or anywhere with my boyfriend, a nurse or somebody from the clinic who knows me will come to the person and say, be careful, this person is HIV positive. You must make sure that you use a condom when you sleep with her. So that attitude, that's the attitude that makes people not be comfortable to go to facilities. But also it was shared that people are also consulted in one room, or they are using one consultation room to consult in different illnesses and talk to different people. So there is no privacy. So the issue of infrastructure, it's also one of the issues that we always pick up in every province, to say the clinics that we are having are very small, and the Department of Health, the National Department of Health, have to look at the issues of expanding the clinics and making sure that the clinics are able to operate and able to cater for all the people who are in that area. So the issue of infrastructure is very problematic, and it needs to be dealt with at a national level. We feel like that the Department of Health, Department of Public Works, they need to work together, and all the departments that are supposed to assist in that area, they need to come to work together in order to close that gap, because it's really serious.
Sibongile Tshabalala, Treatment Action Campaign chairperson, thank you for your time this morning, giving us the narrative on the health situation at Limpopo province, particularly where HIV and AIDS treatment is concerned, and the regression that is occurring.